welcome back to my channel. Today I want to talk about a topic and a subject that some of you may find interesting in. And the topic is called cause effectiveness analysis. Once again, the name is called cause effectiveness analysis in relating to mental health. So why cause effectiveness analysis is important with mental health? You may wonder why, right? So as we know, as a mental health service is getting expanding longer duration of time and also expanding from the government sector to the nationwide sector, then we find out that the cost effectiveness analysis become very important, because beyond or beside improve the client's mental health and their mental well-being, we need to start turning to the attention into the national level or regional level. Means that we have to promote the population that we're working with and improve everybody's overall mental health. So with the amount of people that suffer from mental health disorder or illness, then we need to come up with a way to reduce the overall cost of the mental health system. So that's why the cost-effective analysis become widely used in the recent years and become more important as we go along to how to manage overall mental health budget costs. So cost-effective analysis involved with economic evaluation. We have to make a decision, and it start out with a very basic from individual, but then get involved with the stockholder, get involved with any type of professional practice. It can be ranging from the strategy decision making, how to arrange the medication, and how to locating all those resources possible. But due to the limited budget, with any county, any city, any government sector, with constraint of the money limitation of a financial issue and the resource. Therefore, that's the other reason why we will need to have cost-effective analysis to manage all those costs. Think about how we retain the staff from the hospital, how we retain the psychiatrists, nurses, doctors. Those things also require cost-effective analysis to reduce the cost and make sure that they all follow the best practice as possible. So that's why the cost-effective analysis is very important in the mental health. Because like I said before, we need to make sure the cost-effective is coming there. We need to make sure that we do a good evaluation. We need to make sure that everything will be set in the place. Otherwise, if we overspending all those resources, we will not be able to help every individual. So when I say that, then let's go to the other subject. Then the decision-making skill become very important. Why is that? Because we need to have a better decision-making skill and good financial background in order to do those cost-effective analysis. And also, when we talk about information, when I say information, is all those particular information that we're using are kind of important as well. So let's talk about the second subject. How do we make the cost effectiveness? How do we reduce the cost? For example, I'm just gonna use a person. Why we need to evaluate and use the cost effectiveness analysis and mental health. If we see a client has bipolar disorder, let's say that the client has a bipolar disorder, then as a clinician, you have to make sure, or you are the psychiatrist, you have to make sure, does this person need to be prescribed any type of medication? Is that necessary to prescribe as many medication as possible or less medication? And we also have to think about the quality of the medication. When prescribed those medication, does that improve his quality of a life, right? And we also need to figure out, is that worth it? Right, those are the two things that we can think about. Is that worth it to continue to prescribe more medication? Is the outcome show or have evidence to show that all those medication had impact on reduce his bipolar symptoms or her bipolar symptoms, right? So we have to figure out all those things. That's why the cost-effective method coming in, and also the cost-effective analysis is important. Like I say, we have to think about, does that include improve his quality of life, or is this worth it? Really, as many medication that prescribed to him or her will improve his symptoms, right? So that's something we need to kind of think about. And then the other thing we have to think about is the other type of service that we're looking at will be, we have to make sure the client or the patient, they also need to get to the other different type of service. So that we have to talk about is cost measurement. Why cost measurement is important? Because cost measurement also relating to the cost effectiveness analysis. A client get medication is not enough. The client will need to attend different type of social service. The client may need substance abuse issue. The client may need to go to the psychiatric unit. The client may need to go into an inpatient or outpatient service. Those are type of things that we need to take into the consideration. So that's why that there is a cost measurement that need to be including in the cost analysis and cost effective analysis. And at the end, we need to strategize with all the stockholder. We need to strategize with all the policy maker, and we need to utilize all those resources to help us to determine if the cost-effective analysis will be work in the long term. Because those policymakers, stockholder will help us improve our decision-making process.